and their interactions with the outside world. And while these effects are extremely salient to the person who's experiencing them, hearing loss is deemed invisible because it's undetectable by peers, coworkers, and friends. Added layers to the difficulty of reducing the global burden of hearing loss are the stigma and lack of adequate hearing healthcare. The World Health Organization World Hearing Report explored the effects of unaddressed hearing loss, an exorbitant almost $1 trillion cost per year, with the productivity component amounting to about a fifth of this cost worldwide. And this is the global burden of hearing loss, which is rising every year. But what does this mean for an individual who cannot seek care? People with hearing loss experience higher rates of social isolation, depression, and lower self-esteem. And they have elevated levels of loneliness, and the lack of social engagement can lead to cognitive decline, worsened mental health, depression, and distress. These communication difficulties are extremely susceptible to any kind of societal change, with social distancing and masks during the COVID-19 pandemic, making it more difficult for those who rely on facial expressions, physical cues, and reading lips for their everyday communication. Additionally, people with hearing loss experience worse academic performance and higher unemployment, with children with even mild or unilateral hearing loss experiencing a delay in speech and language developments, and these disparities only compound over time. Children with hearing loss experience slower progression through the academic system, greater risk of dropping out of school, and lower likelihood of applying for higher education. So what can be done to reduce these effects on people who have hearing loss? One is increasing hearing healthcare literacy. So really making sure that people who have hearing loss know how to navigate the realm of hearing healthcare while also reducing stigma. Another is investing in prevention methods, which prioritize early detection and treatment, which will really reduce the number of people who experience unaddressed hearing loss per year and make it easier to address these effects. And three is increasing the access of care in rural and low-income areas and countries globally to ensure that the people who have hearing loss all experience the same access to quality healthcare. And given these effects of hearing loss, to you and me looking at the cost of unaddressed hearing loss, it may be really easy to justify these types of interventions. But the missing piece of the puzzle to motivate policy decisions that prioritize hearing healthcare is the cost of actually addressing this hearing loss. My research in this summer has been to try to provide cost of these services from a patient and societal perspective to motivate these kinds of policy decisions and make the invisible visible, reducing the burden of hearing loss on all affected persons worldwide.